Good morning, everyone. My name is Liz Shea, and I'm part of our talent development team here within the HR team. And I'm excited to moderate this session today on mental health resources to support you through this time. And I'm joined by our two lead therapists from behavioral health to lead you through some resources and then answer some questions that folks have submitted in advance of today's session. So Dr. Ken Duckworth and Dr. Greg Harris. If we're going to answer as many questions as we can today. I know we got a number of them in, and folks may be sending them over via the Q&A chat button in this presentation. So we'll get to as many as we can today, but we'll also be following up with resources after this session to try to address any questions that we may not be able to get to. So if you need anything in the meantime, like I said, be free to ask any questions, and they'll come privately to me during this session during the Q&A. So Ken, I'm going to turn it over off and start leading through some of the resources available, and then we'll head over to Greg, who's going to talk about telehealth and then get into some of your questions.
Thank you, Elizabeth. Good morning, everybody. I thought it might be a good idea for us to pull together some of the resources that we have come upon and to answer some common questions, because of course mental health is a wave of this pandemic. It's an extraordinary time challenging us on many levels. And we thought it was important to have a short session. And if you found this helpful, we can revisit the entire question. So this is the brief agenda. We're going to talk about what's available for the employees of Blue Cross, talk about some resources that Greg and I have come upon as we've contended with people's questions. Greg did a great piece of work on changing telehealth, which is essentially a transformation in how care is delivered. And then we're going to take some questions. Next slide, please. You can see I'm on Dress Down Friday mode. I'm trying to keep a routine, and I dress more casually on Fridays. So here's two items that we have for employees. LifeWorks is an EAP, and for those of you who know, EAPs are resources that aren't necessarily mental health per se. They might be able to help with other life problems. So again, this is not a mental health resource, and I want to emphasize this is totally confidential. In my 9 years at Blue Cross, I have never once been contacted by our employee assistance program. So that's a vehicle to contact for brief support that's not mental health driven, and everybody has access to that. Learn to Live is the second resource I want to mention to you. Thanks to Kathy Hartman and her team's leadership, I was fortunate to sit in on resources around wellness in the fall before all this came our way. And we selected this company, Learn to Live, which is a series of cognitive behavioral supports to help with anxiety and stress. Seems quite well timed, doesn't it? This product is going to be coming in the near future to Blue Cross employees. One of the cool things about Learn to Live is that it is extremely popular among both the college population and the older population, and they have total confidentialities. Neither the health plan nor your employer knows what you're doing in this regard, and this is one of the reasons they've been so successful. Next slide, please. Let's move it ahead one slide. Okay, thank you. So here's a couple general anxiety management strategies. I just want to emphasize we are all being faced, back up to slide 4, please. We are all being faced with an extraordinary amount of anxiety. And the basic anxiety strategies are going to come in somewhat handy, although this is an unusual situation. As I think about it, your brain is wired to perceive threat. You actually have a smoke detector in your brain called the amygdala, and the amygdala is designed to perceive threat. And so if this is why you're exhausted at the end of the day, or you're not sleeping quite the way you want to, or you feel like you're fine but have a kind of sense of impending fear inside of you, that's your amygdala hard at work. So a couple of the strategies are psychological, cognitive, how you think about what you're doing in social distancing, which is an altruistic act designed to protect the more vulnerable. It's also important to think of this work as physical distancing, but social connection. You have to stay in touch with people, and thankfully we have technology to enable that. And also, how you exercise is going to down-regulate your anxiety. So if you were to get care for anxiety, cognitive strategies, not letting your automatic negative thoughts take hold, calming your body through exercise, and thinking about how to stay connected with people and help others is important. So the idea that you take a little bit of this feeling of helplessness and you turn it into action in service of others. This is why we're fortunate to work at Blue Cross, because we're actively helping people on our daily work. The APA Foundation put out a very nice telehealth working from home guide with some tips. We're going to attach that when we, we're going to attach that. For people with psychiatric vulnerabilities, I want to mention these are things that are out there if you already have or somebody you love has a psychiatric vulnerability. This is an anxiety stress test for everyone, but if you already had bipolar disorder or generalized anxiety disorder or an addiction vulnerability, these are resources that are out there. And I just want to mention that AA, NA, Smart Recovery all have online meetings, and there's been a transformation in how care is delivered through telehealth. I'm now going to turn it over to Greg Harris, our Associate Medical Director for Behavioral Health. Greg has done a really nice job with our policy team of basically flipping care from in an office to delivered via tele within 3 weeks. And this is a little side road that no one used to deliver mental health care and is now a superhighway. So I'm going to turn it over to Greg, and then we're going to take some of your questions. Greg, take it away. Next slide, please. Greg, you're going to be talking about telehealth now, right?
Yeah, I'm going to try to. I'm not sure that have things flipped. Can people hear me?
Are.
Great. So thanks for introducing me, Ken. There have been really, as Ken said, very transformative changes in our policies for telehealth. And my sense is in the community is adopting telehealth at lightning speed. That's been my own personal experience. I still have a small clinical practice, and it's been entirely telemedicine over the past month. I'm not sure what's showing right now. There we go. There's several points about what telehealth is as we've conceived it at Blue Cross, is video and audio enabled face-to-face visit between a doctor and a patient, or any provider and a patient. That benefit has been expanded and conceived of as a site of service expansion. So you can see your doctor in their office, or you can see the doctor via telehealth. And so that has been expanded to all patients. And additionally, what we're allowing during the COVID emergency is expansion to audio only. So some people don't have the technology at home and can't make the video connection, but we're allowing during the COVID emergency for the service to be delivered audio only, if that's all the member and the provider can do. And the other change associated with this is the rate of payment is the same, so that the service is looked at as if you're seeing a psychotherapy visit with your patient and provider, it's the same service whether it is delivered in the office, face-to-face, or on a video audio technology. So that's point one. Point two is we're waiving member cost share, copay, co-insurance, deductible for all services delivered through a telehealth mechanism. So the same psychotherapy you visit that you would receive in the office, you have no member liability when you receive it through telehealth. The design is to drive the treatment into telehealth to help enhance social distancing. Next slide. Excellent. Thank you. And then a couple of points about telehealth. Privacy is an issue, and one of the barriers to adoption was getting a privacy-enabled platform, and providers had ambivalence about the technology. And I think now providers are motivated. They're going to look for HIPAA-enabled private technology, but HIPAA nationally has relaxed some of the regulations during the emergency to allow more flexibility. So it gives the providers who are now scrambling for options multiple modalities of being able to provide this treatment and increase access, which I think is a very good thing. So I have colleagues, I have a HIPAA compliant platform. It's our own well connection platform at Blue Cross. I hear of some providers finding other platforms, some using readily available technology, and some using the phone, whatever they can manage to get treatment connected through telemedicine. The next point is about telehealth across state lines. This is a complexity. I think the slide just flipped back, but one of the things you should be aware of as you talk with people, if you're connecting with treaters, where you are as the patient drives the service. So because as a physician, I need to be licensed in the state that I'm practicing medicine. If you're in Rhode Island and I'm in Massachusetts and I don't have a Rhode Island license, I can't practice telehealth. Now, states are relaxing these requirements, but it would just be something to be aware of when you're connecting with a provider through telemedicine, that they know where you are and you know where they are. It's most important where you are, not where they are, and where they have a license to practice. So that'd just be part of the discussion. And then the final piece about this is substance use disorders. There are much more stringent federal regulations about prescribing and about having an in-person live visit with somebody before a controlled substance can be prescribed. So this would be methadone, Suboxone, medications like that. Those regulations are also being relaxed by the federal government, which allows for services for people with addictions to be delivered through telehealth technology. That's transformative. There's never been anything like that. And in addition, there are other regulations that have changed which allow a person to pick up methadone at a pharmacy as opposed to going to a methadone clinic, Suboxone for longer duration of their prescription. So all those relaxation, along with our relaxation of telemedicine, is going to allow really all of our members to be treated through this modality. Now, not every service, of course, can be delivered. You can't get an appendectomy through telemedicine. Certain services, there'll be difficulty. But what we're already hearing, groups going into telehealth. So we have intensive outpatient programs and partial hospital programs for people who've been hospitalized and go home and then need an intensive treatment. And they're beginning to deliver those treatments through these relaxed technology, so using Zoom and things like that to have a group, and you can see all the group members on. And providers are being very creative very quickly, and these policy changes are enabling that. So I'm going to pass it back to Liz.
Let's take some questions.
Yeah, I'm going to read through some questions that associates have submitted in advance of this session, and then we'll try to get to as many as possible that have come through our chat box. So the first one being, we know that obviously this is a struggle to deal with for associates ourselves, but a lot of us have children. So how do you talk to your children about COVID-19?
A great question. And I happen to be a child psychiatrist, so I've traveled in these waters a little bit. But also having raised 3 kids, I have picked up a few things through lived experiences. The first thing is kids are amazing detectors of the emotional vibe in the home. They're wired to pick up on your experience. So if you're going to watch Anderson Cooper, Do it before you see the kids during the day or off camera to them. Because basically, the news is something you need to have some knowledge of, but overdoing your dose is going to make you more anxious. So back to my earlier points, how do you control your anxiety is the first question, because whatever you say is the second most important piece. What they pick up on your experience is the first thing. So if you can keep your amygdala and smoke detector, which is designed to recognize threat and is appropriately going off on the regular, how do you manage that through your own thinking processes, cognition, keeping your negative thoughts in check, exercise, and staying connected to people? Those are the principles. Then the question is, what do you actually say to kids? And so depending on their age, you're going to convey less and simpler information. This is kind of the developmental perspective. So you would talk to an 18-year-old like you talk to an adult. But at a 4-year-old, you would explain that there's been changes, that their preschool has been closed, that there's an illness that's going around, that you're going to keep them safe, you're going to be right here, and we're going to have breakfast, in a little while, and then we'll have cuddle time. Now, this is incredibly hard when you're also trying to work. And so my heart goes out to you if you're trying to work at the same time you're trying to reassure a 4-year-old. I've been looking for the best videos that I found from child therapists on COVID-19, and I'm going to send out one that I thought was compelling in the clips that we're going to send back to you. And it's called Talking to Your Kids About COVID-19 by Dr. Megan Walls, who's a child psychologist. And I just liked her way on it. There are many resources out there, but I've done my best to find a few that are developmentally helpful. That's an excellent question and a tremendous challenge because we haven't really faced anything like this. And of course, this is a marathon, not a sprint. So we're going to have to keep reinvesting in our own anxiety management and our own ability to connect with people and our own exercise and in not letting our most negative thoughts run wild.
Great, thank you. So another question that came through. So I have a loved one that struggles with OCD, and this time has certainly made it worse. What resources are available to them?
So obsessive compulsive disorder is a mental health vulnerability that involves recurrent anxiety-provoking thoughts. They may be about things you haven't done, or in this worst case, about germs, right? And then typically the compulsion is the washing or behavior that you might do, checking the stove, in order to reduce your anxiety. So this is just the basics of obsessive compulsive disorder. And there's a treatment for it that's actually quite effective, that's psychotherapy driven. It's called exposure response prevention. And the idea is you tolerate your anxiety and don't go straight to the compulsion. So these are just the basics of treatment. And we have people in our network who do exposure response prevention. It's a kind of cognitive behavior therapy. So people with obsessive compulsive disorder are going to experience symptoms during this time. This is a tremendous provocation. And I want you to be really gentle with yourself and your loved one who's having this, right? We were not prepared for this as a country. We were not prepared for this as a mental health system. But I think the idea that you have a pre-existing vulnerability and this is hitting right on the nerve of your vulnerability is important to recognize. So there are resources at the OCD Foundation and the International OCD Foundation. There's some nice webinars on strategies. How to think about your thinking is an important theme. And of course, for all people with obsessive compulsive disorder, exercise, reducing the physiologic experience of anxiety is very important. So we'll be sending those resources along with the summary of this little chat.
Great, thank you. So our next question, and Greg, you might be able to help out with this one. How do I find a therapist during this time?
Thanks. Yeah, that was as Ken said, the mental health system wasn't fully prepared, and we have a very decentralized mental health system, unfortunately. So it can be a challenge, but there's help. So we have I would say, sort of two tracks. Number one is we have American Well, which is a vendor that we have that you can go to and set up a mental health visit for psychotherapy specifically. That's the services they provide. That's sort of one track. The other track is to find a provider that you're interested in seeing and then discuss seeing them through telehealth. And my experience is pretty much all providers are scrambling to do this. So what do you do when you're on that track when you don't know where to go? So some of the resources that we have guides. So the OCD Foundation has a sort of a guideline about how to think about finding a therapist for OCD specifically. So you can use guides like that to guide your thinking. And then we have a member directory or provider directory, and you can start there and seek out help. So what happens if you call one or two people and they don't have availability? My advice at that point would be to reach out to our Blue Cross services department for assistance in finding somebody. So we have several layers of that aimed at connecting with members, connecting with providers, and then we have a behavioral health subspecialty team of care managers, psychiatrists, who will get involved if we're really having a particular difficulty connecting a particular person with a particular provider. That's where the rubber meets the road. So don't feel like you're alone with that question. Reach out. You'll have a layered approach to try to help narrow down a provider to find somebody that is a good match for you.
Greg, that only works if you have Blue Cross insurance, though, right?
It works best if you have Blue Cross insurance. Technically, other insurers are supposed to help also. I mean, it is a truth in the state that if you have a different insurer, I'm talking about Blue Cross in our approach. So every company has their own particular approach, but many of the other companies are changing their policies. And if you do reach out to an insurance company, they will try to help you. That's one of the big things. Most providers don't even know that. When I say that to providers and say, you can tell the person to ask for help from their insurer, and they're like, you can? So it's just not a commonly known thing. But we've been working really hard to have a robust system to try to help people here internally, which has really been great.
Great, thank you. So we had a few of these questions come through. For teenagers specifically, feelings of isolation and kind of grappling with missing some of those big life events, whether it be graduation, prom, things like that. So what can we do to support teenagers who are kind of dealing with their own anxieties and isolation as a result of this?
This is a big hit on teenage life because teenagers are already faced with a difficult job, which is becoming an adult. And there's a beautiful essay that I'm going to try to link to called Adolescence is Hard Work. That while your body's changing and your mind is changing, you're also being graded and judged on every topic under the sun. I, of course, haven't dealt with calculus for many, many decades now because I was terrible at calculus. Actually, these logarithmic scales are essentially calculus driven, and so I'm struggling with them even now. It just seems to me that they're going up a lot, right? So I've managed to avoid that. Adolescence is difficult, just for starters. While you're developing your own identity, right, which is one of the core tasks of adolescence, can I develop an identity that's separate from my parents, but yet partially my own, informed by my relationship with them? It's a big challenge to have so much disruption at this time. And of course, the rituals of prom, graduation, are going to be a hit. And this is going to be a defining moment for this adolescent cohort. They went through this. And I think that I'm going to send a few things along. Teenagers are much older and need to be leveled with, right? So the conversation with the 4-year-old is very different than the conversation with the 9-year-old, very different than the 17-year-old. The 17-year-old, you just lay it out, what you're contending with, what they're contending with. This is what I would advise you to do. Listen to them. What are they struggling with? Are they having trouble feeling connected? Peers are the sine qua non of what adolescents are about. Can you support them in having private time to connect with their friends through Skype or Zoom chats or whatever? Is there a way for them to keep their social life alive? I have a colleague whose daughter meets at a local park, and they all sit on their cars 15 feet from each other and visit. This gives you some insight into how important the peer experience is. So I would be honest with them. I would also be honest with, what you're dealing with, but also convey to them the sense that you have a plan. If anybody or in the family were to get ill or vulnerable, they'll be able to appreciate that. Anxiety is designed to activate us to act. And so the idea that the adolescents are anxious and are missing their peer group, it will be important for them to know that the most vulnerable member of the family isn't going to the store. That if someone gets sick, here's the bedroom they're going to be in. I think this is reassuring for people to know that in the worst case scenario, we still have a semblance of control. It's an excellent question, and I think a hard one. And I salute all of you who are contending, with trying to love your adolescents up during this very hard time.
Mm-hmm. Thank you. So we had another question come through from somebody who has a loved one who has been sober, and they're afraid that they might relapse during this situation. So how can they get the support that they need right now?
That's a great question. We can share some resources. There are great resources online. Some were shared on the slide, and we'll add some additional ones as a Massachusetts clearinghouse for COVID-related connections. Alcoholics Anonymous has moved treatment online. That's another sort of transformation. And AA has a COVID-19 page with resources and meetings that are online and through technology. And facilities are still open. We've been reviewing cases, and most of the facilities, and people are worried about outbreaks, but there haven't been yet. And so there are still services available for people who need more than an online treatment. And again, many partial and intensive outpatient programs that are kind of outpatient, multiple groups per day. A lot of these are continuing and moving online. And all that would be, we're approving those types of requests for treatment online.
Great, thank you. Greg, can you also talk, we had a question come through, what's the difference between teletherapy and therapy? Are they the same?
The service is the same. A psychotherapy is a face-to-face interactive treatment between a psychotherapist and a patient to work on issues. There's different types of psychotherapy modalities. So that face-to-face service, whether it's video or in the same office, is the same service. It's an adjustment, because I've been finding it an adjustment. I have spent my whole career in offices with patients before I came to Blue Cross, and making the switch was something I was in the middle of doing before the pandemic, of doing some visits online. But patients are ambivalent, I was ambivalent. And at this point, we've flipped the switch and we're doing the same treatment that we've been doing all along. Is it the same on the telephone? I feel the telephone is not quite as robust, and there's certainly much research about the fidelity of psychotherapy in video. There isn't so much research on the phone. But for my elderly patients who can't manage the video and the technology, it is sufficient to have that psychotherapy service done on the phone for sure. Mm-hmm. And better than the alternative of putting that patient at risk for having them come into the office.
Mm-hmm.
That's right.
Great, thank you. I think we have for one more question before we wrap up. So a question that came through on our chat box is, how important is it while working to prepare for your workday that you'd get ready the same way you would for the office? So getting up, showering, put on your work clothes, and then going into your home office space, figuring that most people are probably working in loungewear. So how important is it to kind of keep that still that same pattern and to kind of prepare you for your workday?
Well, this is Ken. I'll take that. The American Psychiatric Foundation workplace mental health document that we're going to send out suggests exactly that. Get up, exercise, do something with your kids, take a shower, get into your work uniform, whatever it may be. This is my Friday work uniform, it turns out. And will just say, I experimented one day with being Sasquatch, not shaving, not showering, wearing my college T-shirt. And by the end of the day, I was feeling crummier about my overall self. And so it's just my experience that I've fallen into this idea that having a routine, structuring yourself in some way, taking breaks, actually having a lunch break, actually stopping at the end of the day, stopping and saying, okay, the day's over, I'm going to stop now. Then you get out of your work clothes and into your play clothes. So I think there's something to this. I think we all need routine and structure. Our routines and structure have been profoundly disrupted. I read that the entire planet is vibrating less per seismologist because people aren't moving, flying, or in trains or cars. Like the whole world has changed. So you have to impose some structure on yourself to provide yourself with a framework for your day, and this will also reassure the people around you.
Mm-hmm. I would add that that structure, though, may be different. I mean, I'm finding that. So I agree 100% with what Ken said, but I'm sitting in this space you can see, which is a converted art studio in my apartment, and seeing patients from here. And so I definitely dress up in a sport coat and tie when I sit here with patients like I would do in the office. But the day-to-day rhythm is very different because I can't get out in the same way that I used to. So I'm having to create new patterns. I have to figure that out. I've been moving things in this space. My wife is working from home. Neither of us worked from home before this. Now we both have to be doing work at the same time in a small space. So I would say allow yourself the time and space to say how do you need to optimize, because this is going, as Ken said earlier, this is a marathon, and so you might need some time to reconfigure your space to be your 100% space, and make it really work for how it has to work now, not for how it used to work.
Try different things. Yeah, try different things for you. I've come to an understanding of what benefits me based on my experiment with not having any structure or getting out of my casual clothes and not showering one day.
Definitely need structure. Definitely.
It was not great for me. Just personally, I'll just share that. And it may be that you don't have the same need, but this is in the APA Foundation document that will be attached to the write-up of this. So I know we're coming up on the end of time. I made this whole idea up that we should be talking about mental health because this is a wave that's coming with this pandemic. There's a mental health wave that's going to last for a long time. We saw after PTSD studies in Vietnam, in Afghanistan, and 9/11, there's a longer tail for mental health vulnerabilities after even the crisis end. So we get that. If you want to have more of these informal, short conversations, we're delighted to do that. We're your in-source team. One of the things we like to herald is we have an in-source team. We've hired really good people who care about our employees and our members. And so this is an opportunity to leverage that if you find this of any benefit. So thank you all. Elizabeth, do you want to close us out?
Yeah, so again, thank you for joining today, and thank you to Dr. Duckworth and Dr. Harris for leading us through this conversation. I know that we didn't get through every question, but we'll take the information that we receive, the questions from you, and try to incorporate that into the resources that get sent out post-event. So we did record today's session. If you want to share it with others or you'd like to view it again, and we'll be sending out a copy of that along with these resources to everyone who attended today. So thank you, and enjoy the rest of your day and enjoy your weekend. And feel free to reach out to me directly if you would like to see more of these sessions as well. Thank you.
Thanks, everybody. Take care.